There are many challenges in the world you will enter as graduates, and I will name just a few. There are the challenges of climate change and its many implications for our future, the challenges of continued inequities and worrisome growth of divisiveness, discrimination, and racism, the persistence of violence and of social and economic systems that often do not promote health, but do just the opposite. But you have three key tools at your disposal. You have your knowledge, your skills, and your values. So go out there and use them. Congratulations, class of 2018.
The beauty of public health is that on top of receiving an education about the way that things are, we have been offered tools to go out into the world and to change them. We vow to honor the legacy of our school's founder, Dr. Jonathan Mann, and our school's mission statement, that health is a human right, because health is a human right.
You all, the next generation of public health leaders, must transform public health. There have always been moments in our history when a generation has been called on to do more. In the earliest 20th century, public health evolved to be able to eradicate plagues with vaccines. It made comprehensive public health available to everybody in our society. In the second half of the 20th century, public health stepped up to address new challenges like the HIV/AIDS epidemic and focus on the most vulnerable in our society by giving those without a voice. Which brings us to today, to a critical moment in time when this country needs you, when we have a new movement called Public Health 3.0 that asks us to see a bigger future, that asks us to go beyond the traditional roles of public health and our functions and programs and bring sectors together to bring something along that we cannot do alone. It calls for all of us to do our part, bridging across sectors and making systemic change, just in the way we did in New Orleans after Katrina. It also requires leaders, like all of you graduates, to take up the mantle of a chief health strategist, to bridge the progress we've made in the past with a vision of a better, more equitable, more just future for everyone, no matter their zip code. I know that's why you studied public health, why you're here today, because you want to lead to a better future, whether it's through the mantle of public policy, biostats, epi, maternal child health, all the facets of public health. These are more than a job, they are a calling. We are healers, not of broken bones, but of broken communities, of families unsure how to get their kids the kind of food that will nourish them through the day, of brothers struggling to find jobs with a living wage, and of little girls who never get to move across town. To do this work as a chief health strategist, you don't need a fancy title. You just need to be the kind of strategic, inclusive, activated leader that is modeled right here at Drexel.